Welcome back to the deep dive.
Hello again.
So today we're digging into a set of notes you shared with us. They're all about a condition that, well, affects millions, doesn't it? Often just in the background of daily life.
That's right. Allergic rhinitis.
We're going to try and unpack these notes, pull out the absolute must-know info, make it clear, make it memorable.
Yeah, distill it down. Because understanding this is actually pretty important, Its impact is wider than people often think.
Definitely more than just a few sneezes. It really affects health, quality of life.
Absolutely. Often underestimated.
Okay, let's get started then. Right at the beginning, what exactly is allergic rhinitis, according to these notes?
Okay, so at its core, the notes say it's an inflammatory disorder.
Right, inflammation.
Specifically, inflammation of the lining inside your nose, the nasal mucosa. And it's kicked off by an allergic response to stuff you breathe in. Airborne allergens.
Got it. Nose inflammation from breathing in allergens. Simple enough. And the symptoms people usually get?
Well, the classic ones listed are nasal congestion, feeling blocked up.
Sneezing, itching, which could be nose, eyes, even your throat, and rhinorrhea. Fancy word for a runny nose.
So blocked, sneezy, itchy, runny. Those are the big four. Now, the notes classify it in different ways.
Yeah, mainly based on when symptoms happen and what triggers them.
Yeah.
You've got seasonal, that's the classic hay fever type linked to pollens. Then there's perennial, meaning year-round symptoms.
Perennial, like permanent.
Sort of, yeah, persistent.
Oh,
And occupational, which is triggered by something specific at work.
that makes sense. So for you listening, which type you have probably depends on your specific allergies and, well, where you run into them.
Exactly. And connecting back to why this matters, the notes really hammer home the impact.
Right.
It messes with work, with sleep, school attendance.
And here's a point from the notes that really jumped out at me. It's called the most common chronic childhood disease.
Yeah, that really puts it in perspective, doesn't it? How common it is, especially starting young.
It does. And there's another critical link mentioned. If it's not managed well, it's a big risk factor for developing asthma or making existing asthma harder to control, plus the general hit on quality of life.
So it's way beyond just being annoying. It's got real consequences for daily life and long-term health.
Definitely. Okay, so moving on to why it happens. The etiology bit in the notes, the causes and factors.
Let's unpack that. What's actually going on in the body?
Fundamentally, it's the immune system overreacting. Your body sees things like pollen or dust mites, pet dander, mold spores, stuff that's normally harmless, and mounts an immune attack against them.
Right, it thinks they're invaders.
Basically, yes. The notes mention it's a mix of genetics, it can run in families, and environmental exposure.
Nature and nurture again.
Pretty much. And they specifically call out house dust mites as the main culprit for perennial year-round rhinitis.
Ah, good practical tip if your symptoms never seem to stop.
Mm-mm.
The notes also list other conditions often seen alongside it.
They do. Things like conjunctivitis, itchy, red, watery eyes. That's very common.
Makes sense. Eyes and nose are connected.
Yeah, and it's often part of a bigger picture called atopy. That includes eczema and asthma, too.
Ah, the atopic march.
Kind of, yeah.
Yeah.
Also, rhinosinusitis inflammation spreading to the sinuses and nasal polyps are linked.
Interesting how these inflammatory things cluster. So who's more likely to get it? What are the risk factors?
Key ones listed are family history of allergies, having eczema or asthma yourself, obviously being exposed to specific allergens, and interestingly, living in urban areas.
Urban areas. Why is that?
Potentially pollution acting as an irritant or maybe making allergens worse somehow. The note suggests that link.
So your genes plus where you live and what you breathe in.
Exactly.
Okay, this next part is fascinating, the pathophysiology. The notes explain the actual biology, how the reaction unfolds.
Yeah, this is the nitty-gritty. It's a type 1 hypersensitivity reaction.
Type 1, what does that mean in simple terms?
Think of it like your immune system setting up a super sensitive alarm system for specific allergens.
An alarm system.
So first exposure, if you're susceptible, your body makes these special antibodies, IgE antibodies against that allergen.
Right.
These IgE antibodies then stick themselves onto immune cells called mast cells, which are waiting in your nasal lining. They're like primed.
Armed and ready.
Exactly. So the next time you breathe in that same allergen, it bumps into those IgE antibodies sitting on the mast cells. That's the trigger. The mast cell basically degranulates. It releases a whole bunch of chemicals it's been storing, like histamine and other inflammatory stuff.
Like pulling a fire alarm and all the inflammatory chemicals rush out.
That's a good analogy. And it's those chemicals, especially histamine, that cause the immediate inflammation and symptoms, the sneezing, the itching, the runny nose.
Okay.
And the notes point out two phases. There's the acute phase happens within minutes. That's your instant sneezing, runny nose.
Right.
Then hours later, usually 6 to 12 hours, you get the late phase response. Different chemicals are involved here, and this mainly causes the nasal obstruction, that blocked up feeling that lasts longer.
That explains so much. Like why you might sneeze immediately walking into a field but then feel bunged up all evening. It's those two phases.
Precisely. It links the biology directly to what you actually feel.
Okay, so because those symptoms, runny nose, congestion, are pretty common, the notes list other things it could be confused with. What's on that differential diagnosis list?
Yeah, important not to jump to conclusions. The notes mention things like non-allergic rhinitis looks similar, but no allergy trigger.
Like changes in temperature causing symptoms.
Could be, yeah. Also, infective rhinitis, a cold or virus, structural problems like nasal polyps or a deviated septum, sinusitis. And in kids, enlarged adenoids, adenoidal hypertrophy.
Right, those seem like the main ones to check. Anything less common?
They also list rarer things like cystic fibrosis, Cardiganer syndrome, both genetic conditions affecting mucus, and even some systemic diseases like lupus or granulomatous conditions, plus other anatomical issues in the nose.
Wow, quite a list. It shows you need a proper check. And the notes flag some red flags too, right? Things that need urgent attention.
Absolutely critical. Unilateral watery rhinorrhea, so clear fluid dripping from just one nostril that could be a CSF leak. Serious stuff. Needs immediate checks.
Okay, one-sided watery discharge is red flag.
Yes. And also, unilateral blockage, pain, or bleeding from one side could suggest a nasal neoplasm, a tumor. That also needs urgent specialist referral.
Vital points. Don't ignore one-sided symptoms. Okay, shifting gears to how common this is. The epidemiology.
Right, the numbers.
What do the notes say about prevalence, especially in the UK?
It's incredibly common. The notes state over 20% of the UK population is affected.
More than 1 in 5 people. That's huge.
It is. It often starts in childhood or young adulthood, but you can get it any age. There's a pattern mentioned. Kids and teens often get the seasonal type, while adults might have more persistent perennial symptoms.
So it can change over time.
Yeah, and peak onset is often before age 20. Something like 80% are diagnosed by then.
Starts young for most people, then?
Seems so. They give specific figures, too. Around 10% of 6, 7-year-olds, and maybe 15, 19% of 13, 14-year-olds.
That's a lot of kids dealing with sniffles and sneezes.
And the notes suggest the real number might be even higher because lots of people probably just self-medicate or don't report it. Plus, some have mixed rhinitis, a bit of allergic, a bit of non-allergic.
So, bottom line, if you have this, you're definitely not alone. It's everywhere.
Which brings us to the clinical picture, what it actually looks and feels like day to day, and what a doctor might see.
Okay, let's paint that picture based on the notes. Symptoms and signs.
We've touched on the main ones: the congestion, sneezing, itching nose, eyes, throat watery, runny nose, post-nasal drip. And those eye symptoms are really common too. Watering, itching, redness, even swelling.
And beyond the obvious nose and eye stuff.
Fatigue, headache, poor sleep, those are listed as associated symptoms, linking back to that quality of life impact.
Right. And during an examination.
A doctor might notice the sneezing, see the bilateral nasal obstruction, the clear discharge, maybe signs of itching like the allergic salute, that upward nose rub kids sometimes do.
Ah, yes, I've seen that. And the timing clues.
Crucial, as we said. Seasonal patterns point to pollens. Tree pollens, early spring, grass, later spring, early summer, weeds, spring through autumn.
So asking when it happens is key.
Definitely. Perennial is year-round, maybe worse on waking. Dust mites, often worse autumn, spring, even at present all year. Animal hair triggers might be obvious exposures.
And occupational.
The big clue there is symptoms getting better when you're away from work, weekends, holidays.
That makes sense. What about what the inside of the nose looks like?
The notes say the nasal lining, the mucosa, often looks swollen and maybe pale or grayish, not red like with a cold.
Interesting difference.
You might also see signs of chronic congestion, mouth breathing, maybe a cough from the drip, even bad breath sometimes. An exam would also check the eyes for conjunctivitis and generally rule out other things. And they mentioned checking cranial nerves, just a nod to those rare tumor possibilities if symptoms are suspicious.
It really highlights how a good history, asking about timing and triggers, plus a careful look, helps nail down the diagnosis and cause.
And to confirm it, especially the specific triggers, the notes cover investigations.
Right, the tests. If a doctor suspects allergic rhinitis, What might they do, according to these notes?
The main one is usually the skin prick test. It's quick, reliable, gives immediate results. If the test matches the patient's history of reactions, it's very predictive.
But there's a catch with medications.
Yes, important point. Antihistamines, some steroid creams, certain antidepressants can interfere. Patients often need to stop them for a bit before the test.
Good to know. What if skin tests aren't an option, like bad eczema or something?
Then blood tests can be used. They measure IgE antibodies in the blood, both total IgE and IgE specific to certain allergens. The notes mention RAST or ELISA methods.
So blood tests are plan B. Any other ways to measure nasal function?
There are objective measures mentioned, like peak nasal inspiratory flow, acoustic rhinometry, rhinomanometry, but the notes say these aren't really routine for diagnosis.
More for special cases.
Yeah, maybe for research, specific allergen challenges, or checking airflow before surgery, that kind of thing. Not for your average case.
And what about imaging, like a CT scan?
A CT scan isn't standard either. It's usually reserved for when medical treatments aren't working, or if there's a strong suspicion of chronic sinusitis that isn't clear from history and exam, or, again, if there's concern about a neoplasm, those red flag cases.
Okay, so tests help confirm the allergy, find the trigger, and crucially, rule out those other possibilities we talked about.
Exactly, which leads us neatly into management. Once you know what it is, what do you do about it? This is probably the most practical bit for listeners.
Absolutely. Let's get into it. How do the notes say allergic rhinitis should be managed?
The absolute cornerstone stressed in the notes is allergen avoidance.
Makes sense. Avoid the trigger.
Yes, but it has to be tailored. Avoiding pollen is very different from avoiding dust mites or pet dander. So identifying the trigger is key to making avoidance effective.
Right. First step, know your enemy. Then, medications.
Medications are the next major step. For milder, intermittent symptoms, the notes suggest antihistamines, either tablets or nasal sprays.
Okay, standard antihistamines.
But for moderate to severe symptoms, or persistent ones, the first-line recommendation is usually intranasal corticosteroids, those steroid nasal sprays.
They seem very commonly prescribed. What if things get really bad, like a major flare-up?
Short courses of oral corticosteroids, steroid tablets can be used to quickly calm down severe symptoms.
Short bursts only, though.
Yes, and topical nasal decongestant sprays are mentioned too, but with a strong warning. Only use them for a few days max. Longer use can cause rebound congestion, making things worse.
Ah, the dreaded rebound. Any other drug options?
Quite a few listed as additional options. Nasal saline washes, just saltwater rinsing, are safe and can help clear things out.
Simple but effective.
There's a combination spray mentioned, Zelastine, an antihistamine, plus fluticasone, a steroid which might work better for some people.
2 in 1.
Ipratropium bromide spray can help if a very watery, runny nose is the main problem. Montelukast tablets are another option, sometimes particularly useful if someone also has asthma.
Different mechanism, right?
Yeah, targets leukotrienes. And again, they mention topical decongestants just for very short-term opening up.
Wow, quite an arsenal.
Yeah.
It sounds like treatment is really layered and personalized.
It should be. And if medications and avoidance still aren't enough, especially if there's a structural issue like a badly deviated septum,
Then surgery?
surgery might be considered, yes. Things like reducing the turbinates inside the nose to improve airflow, fixing the septum, or endoscopic sinus surgery if chronic sinusitis is also a big factor.
Okay. And what about tackling the allergy itself, not just the symptoms?
That's immunotherapy. Desensitization. It's generally reserved for severe cases that don't respond well to other treatments.
How does that work again?
You're given gradually increasing doses of the allergen you're allergic to, either by injection under the skin subcutaneous or drops tablets under the tongue sublingual.
Retraining the immune system.
Essentially, yes. The notes say it's usually a long-term commitment, typically around 3 years, and can start from age 5.
A big undertaking, but potentially life-changing for some.
Absolutely. So the overall management principles reiterated are: avoid allergens, educate the patient, use medication stepwise, and refer to specialists when needed.
It's a really comprehensive approach described in these notes. Lots of options available.
So thinking long-term, what's the outlook? The prognosis section. Is it something you're stuck with forever?
What do the notes say about that? Prognosis for allergic rhinitis?
Generally, they say it's good. While it is often a chronic condition needing long-term management, symptoms can usually be controlled well with treatment and avoidance strategies.
So, manageable for most people.
Yes, and there's a hopeful note too. Symptoms often improve over the years, particularly with seasonal rhinitis.
Oh, really?
Yeah, and they even mentioned that seasonal allergic rhinitis might spontaneously resolve, just go away on its own in up to 20% of people over time.
20%. That's actually quite encouraging. So while often chronic, good management works, and some might even grow out of it.
Exactly, provides a bit of reassurance.
Okay, finally, the notes cover complications. What can happen if allergic rhinitis isn't managed well?
We've touched on some already. The big one is that impaired quality of life, poor sleep, fatigue, concentration problems, lower productivity.
Which really shouldn't be underestimated.
Absolutely not. Then there's the increased risk of developing asthma or having worse asthma control.
The asthma link again.
Yes. And other potential problems listed include sinusitis becoming chronic, developing nasal polyps, and particularly in children, chronic otitis media persistent middle ear infections or fluid because the congestion affects the eustachian tubes.
Right. So managing the rhinitis helps prevent these other issues from developing.
That's the idea. It reinforces why taking it seriously and managing it properly is so important.
So reflecting on everything we've pulled from these notes, the biology, the symptoms, the impact, the treatments, what feels like the most crucial takeaway for you?
For me, it's that link between the underlying allergic mechanism, that type 1 reaction, the mast cells releasing histamine, and the sheer breadth of consequences.
Yeah.
It's not just a nasal issue. It starts in the nose, sure, but as the notes show, it directly connects to sleep, fatigue, concentration, asthma risk, sinus problems. It highlights how it's really a systemic issue manifesting initially in the nose, and understanding that helps make sense of why management needs to be comprehensive.
That's a great point. It connects the microscopic cause to the macroscopic impact on someone's whole life. It's not just hay fever.
Exactly. And that really underscores how treatments like antihistamines or immunotherapy are directly targeting that core biological process.
It all comes back to that initial allergic trigger and response.
Which maybe leads to a final thought stemming from these notes. We know allergic rhinitis is incredibly common, over 20% prevalence. We know it links to asthma, impacts quality of life significantly. So how much potential is there to improve overall population health, productivity, maybe even reduce asthma rates if we got better at raising public awareness, diagnosing it early, and ensuring people have access to effective tailored management?
That's a really powerful question to ponder. What impact could better management have on a massive scale? Well, thank you for joining us for this deep dive into these very detailed notes on allergic rhinitis.
Hope walking through the definition, causes, impact, management, all of it has helped clarify things.
Absolutely. Unpacking notes like these really is a great way to get a handle on complex conditions quickly. Thanks again for sharing them. We'll see you next time for another deep dive.